A frequent question that comes up during patient consultations for facelifts and neck lifts is how are we going to avoid an unnatural result? In fact, I think this is probably the #1 concern of my patients. It's certainly my #1 concern. So how do we go about achieving natural results with facelifts and with neck lifts? First of all, I think it's extremely important, as with all plastic surgery, to go back to a careful study of natural form. I encourage my patients to bring in pictures from 5, 10, 20 years ago, even longer, so that we can take a look and see how the individual process has occurred in their unique circumstance. Once that's accomplished, then we have to draw upon our careful study of the facial aging process. Point #1, we have to understand the process of structural descent, because that's one major component of the aging process. As we age, typically structures in the cheek, the jaw border, the neck, the outer brow begin to descend in sometimes predictable, sometimes unpredictable ways. And it's necessary then for us to bring these structures back to the natural position that makes sense for that individual person. Another very important point is the facial volume and how this changes, because as we age, we tend to lose fat in certain zones: the upper cheek, the front of the chin, the framing zone around the lips, the temple, and other areas. And that's a very important aspect. And in the past, I think one of the reasons we had so many overpulled facelifts in some places in the country was that people were pulling too much because they couldn't compensate for the loss of volume. Once you add volume, you have a much more balanced result. I think if we pay careful attention to these 3 areas, we can get very consistent and natural results for our patients.